Things I've seen in the emergency room, ER nurse edition, hand, foot, and mouth disease, a common viral infection in children ages 6 months to 4 years old. Older kids and adults can also catch hand, foot, and mouth disease, but it's very typical in younger kids. And it usually starts with a fever. So a child presents with fever at 101 to 102 degrees Fahrenheit, and a day or so later, they will present with mouth sores, usually in the back of the mouth, the tongue, the gums, or the inner lips. And sometimes that's all that the patient will have, and other times it will be a day or so later the patient will present with sores on the hands, feet, on their bottom, elbows, knees, and sometimes the rashes are tiny dots that are barely noticeable, and other times they are fluid-filled blisters. Because it's highly contagious through the saliva, the nasal secretion, feces, and also if there's the blisters, the fluid can make it contagious. So we want to make sure that we isolate the child. It's typically contagious 2 days before the rash appears and 2 days after the rash goes away. Because it's a viral infection, we do not prescribe antibiotics, but we want to make sure we prevent dehydration, because when the patient has mouth sores, they're typically fussy, they don't eat, they don't drink, they're drooling more than often. So we mix equal parts liquid Benadryl and Maalox, and we will dab it on the patient's mouth sores, or sometimes if they're able to, they can swish and spit it out.